3 minutes to death. It's the evening after a hard day's work at the Amazon warehouse for young Jake. He and his girlfriend Becky are grumpily sitting on each side of the long sofa watching Love Island. Jake, who still feels a bit raw about a recent union vote going the wrong way, suddenly stands up and shouts, "Why in God's name are we watching this brain-rotting garbage? It's stupid. They're all idiots." Minute 1. And that's it. That's all it takes. He collapses on the spot, and let's just say he doesn't look very good. He's fit, he's young, he's never really had any health issues, but there he is on the floor, and he's not breathing. Minute 3. Becky, who's a big fan of the TV shows ER and General Hospital, believes she's more or less qualified for a medical emergency. Having graduated from the school of couch potato, she remembers exactly what to do, and fortunately, thanks to some drunken karaoke sessions, she remembers the words to a song whose beat is perfect for performing CPR, aka cardiopulmonary resuscitation. Minute 6. As she gets over Jake's chest, she starts compressions with both her hands. The song's going through her head at the same time. "Well, you can tell by the way I use my walk, I'm a woman's man, no time to talk." And she stops to breathe air into his mouth 2 times after 30 compressions, and then she carries on. And we're staying alive, staying alive. Minute 7. The good news is that her neighbor has heard her screams and is at her door immediately. The emergency services have been called and are already on their way. But Becky doesn't really know what's happened to Jake, and she's not all that savvy to statistical data relating to out-of-hospital sudden cardiac mortality rates. It's grim, with less than 10% of all victims surviving. It's a pity then that in the US 70% of out-of-hospital cardiac cases happen in the home and only 6% survive. What's happened here is that this young and healthy man's heart just stopped. We're going to tell you why later, but before that we suggest you listen to all the clues we'll give you throughout this show. Jake was really fit. He was on his feet all day at work. He went to the gym when he could, although he was stressed and argued a hell of a lot with Becky. You should also know that cardiac arrest can come out of nowhere and kill the healthiest of people, even young people. Sometimes doctors don't even know why it's happened. Minute 12. It seems Becky's TV-honed medical expertise has done the job for now. Her CPR technique isn't bad at all. She thought he was dead. And for a while, he technically was. And Jake became one of around 9 million people in the US who have had a near-death experience, aka NDE. Minute 14. He didn't have an out-of-body experience, or OBE, meaning he didn't rise up into the air and see his girlfriend trying to keep him alive. But like many people who've had NDEs, he felt a wonderful comfort as he was crossing over. He felt calm, and as he walked toward an ethereal light, he embraced death with a feeling that you could call ecstatic. This isn't out of the ordinary with cardiac arrest victims. He would have died for sure had those chest compressions and kisses of life not helped blood and oxygen circulate around his body and get to his brain. Still, an issue that Becky's unaware of is for some time no oxygen was getting to Jake's brain, and that can cause all manner of mental and physical disabilities. He might not even have had enough brain power to enjoy Love Island again. But even with limited consciousness, he should still be okay in that regard. Even if he does get to the hospital alive, statistically he only has about a 5% chance of coming out alive. Minute 25. The red emergency phone has been called at the hospital, so the doctors and nurses are all set up, which includes having a cart full of medical supplies nearby, known as a crash cart. It contains many things, including adrenaline, which Jake will receive every 3 to 5 minutes in the hopes that it'll return spontaneous circulation, meaning his heart rhythm. Minute 35. After the ambulance arrives, the team gets the essential information from the paramedics, the people who've been keeping Jake alive by shocking his heart, better known as cardiac defibrillation. They explained that they've managed to get some amount of heart rhythm back, so on their checklist, they've put a tick in a few boxes. One tick has gone in the bystander CPR box. That was the work of Becky. They also tick the boxes for compression started, ventilations, and defib. They've gladly put a tick in the return of pulse box, but also the box for re-arrest. The best news is that they haven't checked the box that says termination of resuscitation. This hospital resuscitation team is about 6 people consisting of a lead doctor, someone to do the compressing, an airway manager, the person in charge of the defibrillator, and the person administering the medications. There's also a person just keeping track of time, important when every second counts. Minute 45. After each shock, the compressions start again, and air is pumped into Jake via something called bag valve mask ventilation at a rate of 8 to 10 breaths per minute. The team is doing its best. It might just be a day at work for them, but they hate losing a person, especially when that patient is so young. The person doing the compressing has even broken one of Jake's ribs, which isn't all that unusual in these situations. A broken bone is the last thing anyone's concerned about right now. And when you're doing something like 100 compressions a minute at a depth of 5 centimeters, it's easy to injure someone. At least they don't require disco music to do their job. As is protocol during all this time, hospital staff has been getting as much information from Becky as possible, such as listening to her when she says, "We were just watching Love Island and he got up and shouted at the TV and then just collapsed. It came out of nowhere. Jake's fit as anything." This information, though scant, is actually important since the doctors need to know what might have caused the cardiac arrest, so if Jake does survive, they might be able to stabilize him. There's just no way he can get any scans at the moment, as all efforts are concentrated on trying to make his heart beat again properly. Minute 59. In the end, though, the return of spontaneous circulation doesn't happen after about 20 minutes of trying. Poor Jake is not coming back, but before he goes, he has an out-of-body experience this time and sees himself being worked on. He feels no fear whatsoever. He meets death with open arms. It beats working for Amazon. Meanwhile, Jake's parents have arrived at the hospital and are waiting in a special room not far from trauma. They're hoping for the best. When not too far away, Jake's pupils are fixed and dilated. Make no mistake, the lead doctor is thinking about those parents. The entire team has the weight of the world on their backs right now. 1 hour, 10 minutes. It's the lead doctor that makes the final call to terminate resuscitation, but he doesn't do that until he's consulted everyone in the room. It comes at the time they're no longer to think there's even a shred of hope of Jake surviving, and the lack of oxygen to his brain and other tissues have caused catastrophic damage. Jake is brain dead. His current state meets with something called the determination of death protocol. Still, you can't just say that, you need some technical evidence. Part of this is a printed slip of paper that shows there is no heart rhythm at all. Everyone in the room knows this, and they all agree with the head doctor that all resuscitation efforts should be stopped. A cover is pulled over Jake's face, and someone reads the time of death. There are a lot of things that are going to happen right now with Jake, his parents, his girlfriend, and of course, we still don't know how this fit young man died. 1 hour, 25 minutes. First of all, the doctor who's about to give the family the bad news will get out of his scrubs. He knows to use Jake's name rather than just say your son is dead. He'll recount as much as is possible to explain what happened. In this case, as in many cases, he'll make sure to explain to the family that everything that could have possibly been done to save Jake's life was done. The doctor tells it how it is, meaning he says dead and not passed away or no longer with us. You have to be clear in these situations. Jake's parents are sitting down as they should be, and after the doctor tells them, he doesn't just get up and leave. It's especially hard for the parents in this case, because the death is totally unexpected, so they need to know all the details. 1 hour, 40 minutes. There's a lot of initial shock, but unlike some parents in these situations, Jake's family does not get angry and blame someone. It should be said, how a doctor relays such devastating news is a skill itself, and something medical school can't really teach you. Older doctors with more experience are often the best ones for this difficult task. You never sent interns to do such a job. With tears streaming from the family's eyes, the doctor explains to them that Jake was not in any pain when he died, and he tells them at this point they don't know why he went into cardiac arrest. Jake's case right now meets the requirements for sudden unexplained death, or SUD. 1 hour, 50 minutes. Jake's body is lying on the bed and the room is cleared of any clutter. All the life support equipment that was connected to him is removed and taken away, and he's made to look as presentable as possible. Since it was cardiac arrest and nothing too messy, Jake already looks quite serene, although some of the jelly on his chest used during the shocking of his heart has been wiped off. The doctor waits with the parents until he thinks they're emotionally strong enough to see their son's body. They have to confirm identification, and of course, they'll want to see him anyway. They also have to collect Jake's belongings and at some point fill in some details so a death certificate can be made. When all that's done, they'll be talked through what was going to happen during the autopsy. They've already said that they want one done, and while autopsies are usually rare, they aren't with SUDS. Hour 2. What we do know for sure is that he's now legally dead, and his body's beginning to cool. Also, just a few minutes after he technically died, his muscles started relaxing, something known as primary flaccidity. Under the covers, some of the urine and feces that were stored in Jake are released, as the muscles can't hold it in. This is quite normal. 2 hours, 15 minutes. It's during this time, just after death, that Jake takes a shade of white. That's because his small blood vessels called capillaries have collapsed. The technical term for this is pallor mortis. It usually happens at just 15 to 25 minutes after death. You might have seen pictures of dead people and noticed that they don't just turn pale. but they have a red-purple color starting to show on parts of their body. This is called livor mortis. Jake's blood is no longer being circulated around his body, and the blood is starting to pool where gravity wants it to pool. That's because blood cells have broken out of blood vessels. This is already happening to Jake, but it'll take a couple of hours at least for these colorful patches to appear on his body. Hour 4. There's also algor mortis, which means Jake's body is no longer in charge of its own temperature, so it starts to be warm or as cold as the temperature of its surroundings, in this case an air-conditioned hospital. As you probably know, when people die where it's hot and when no one finds them, they start to get very stinky and oozy pretty fast. But Jake's in good hands at the hospital. The temperature will also affect how quickly the body stiffens, something called rigor mortis. The hotter it is, the faster a body gets hard. Hour 5. As you know, Jake's parents want to know what happened to him, so they give their permission for the hospital to do an autopsy. A medical examiner will open up the corpse and take a look around to see if the death seems unnatural, or at least unusual, and certainly when it involves crime. Jake's death isn't suspicious as yet, although who knows if he didn't suffer a toxic cardiac arrest after being poisoned. We say this because Jake's girlfriend has a personality disorder, and she threatened to put rat poison in his coffee in the past. Not long after another one of her violent outbursts, followed by a dramatic, erratic, and unpredictable behavior, she broke down in tears and then became extremely threatening to Jake when he informed her that he was leaving her. Sure, she helped save his life, but with this girl, nothing is predictable. She's also cunning enough to know that no attempt at saving him might arouse suspicion, and she's also smart enough to know poisoning can cause cardiac arrest. What she might not have bargained for is a toxicology report, which, let's face it, any good killer would have thought about. So, in Jake's case, the authorities can't just say cardiac arrest and leave it at that. They must look under the hood and in the blood to see what caused his heart to stop. The medical examiner will first be looking for signs of heart disease that were never apparent to Jake or his family. He might have had a structural abnormality of his heart for various reasons, including the possibility that he inherited it. He could have another abnormality such as clotting. He might have had an underlying sickness that played havoc on his heart. Some viruses can cause cardiac arrest too. He might also have had an arrhythmia syndrome, meaning something that caused his heart not to beat, and this can go undetected until it kills a person. In short, the sudden cardiac arrest has many causes, and sometimes they aren't that obvious. Even though Jake was young when he died, his lifestyle might have brought about his heart problems. Jake didn't smoke or drink very much, but he did have a weakness for a drug he used to call the devil's dandruff: cocaine. This drug has been known to cause cardiovascular toxicity, heart attack, and cardiac arrest. Maybe he'd slinked off to the bathroom during the commercial break to do a line, so he might better endure Love Island. Maybe that's why he lost his temper. We just don't know, so the medical examiner will be looking for various toxins in his blood, which is called a toxicology exam. On a paper recently published in the Journal of the American Heart Association, in 31 cases of young people that had died from sudden cardiac arrest and were then autopsied, drugs were found. And although cocaine is often the drug talked about when it comes to heart damage, other drugs included booze, opiates, antidepressants, and benzodiazepines. His eyelids, jaw, face, and neck are now stiff, but all of his muscles are gradually affected, including his internal organs. And he'll remain stiff like this for at least a couple of days, and then he'll start to become loose again. By the way, doctors can easily move a stiff body part into a different position, but if something called a cadaveric spasm has occurred, it might be more difficult. Hour 6. Jake even lets out a groan, which is nothing but trapped air leaving him. It's quite normal, though upsetting to people if they haven't heard it before. If he were left outside in a garden or dumped in some waste ground, once his body was getting looser, he'd be visited by lots of creepy crawlies. They would start laying eggs in his body as it turned a shade of greenish yellow. The eggs hatch, and then you have maggots. They gobble up what they can, and then turn into flies themselves. And as the cycle starts again, what you have is a very efficient cleanup job. Jake would start to stink as this happens because he would now be in the stage of putrefaction. This is the breaking down of the body. Its natural decomposition, including the eventual liquefaction of the internal organs. His immune system would no longer be functioning, and that would mean trillions of bacteria, many of them in his gut, leaking out and starting to devour other organs and tissues. The body starts eating itself, which thankfully doesn't happen when people have a working immune system. Again, loads of factors affect how fast this happens, but it happens to all of us in the end. We become a great big bag of stinking gases that distends the stomach. These gases, including smelly methane, hydrogen sulfide, and ammonia, can build up so much that the stomach basically bursts. So we're time bombs in some respects. Liquid also comes out of various parts of the body, which is called post-mortem purging. You might wonder why dead bodies stink. That's because chemical compounds such as cadaverine and putrescine make your body smell like rotten eggs, scatoli smells like poop, hydrogen sulfide like rotten eggs, and methanethiol like old cabbage. Given enough time, the face won't look much like the face of the person that died, and the hair and nails will go. Everything becomes soft and liquefies, and eventually all that's left is the skeleton. All this is going to take a long time with Jake because he's being treated to 5-star hospitality at the morgue. There, he's afforded a first-class fridge that's going to keep him in tip-top condition, and later he's going to experience a makeover. 6 hours and 30 minutes. Jake is lying on the examination table ready for autopsy. First, the pathologist gives the body an overall inspection. Blood samples have already been sent off to the lab, and his family has already been questioned more thoroughly about possible genetic problems. Jake's body also goes through genetic testing, which is testing his blood or tissue for alterations in chromosomes or genes. The pathologist is wondering if a cardiac disease might have caused either an arrhythmic or a mechanical issue with the heart, and she's also thinking about possible trauma to the heart. She now has the information as to state of mind Jake was in when he first collapsed, tired after work, getting angry at the TV, which is very different from something happening in his sleep or on a sports field. She knows he had no significant illness, has never complained of chest pain or palpitations, and didn't have hypertension, respiratory problems, or had fairly recent infectious disease. Neither had he recently had any kind of surgery. Hour 7. She checks for abnormalities on the skin and hair, then opens him up with a Y incision. 7 hours 45 minutes. Jake's skin is pulled across his chest and his ribs are clipped with a pair of special shears. At first, the doctor just takes a look at what's inside and then takes a blood sample from the heart. She weighs it, looks at the thickness of the heart wall, and considers what she finds with his height and total body weight. 8 hours 15 minutes. She carefully weighs other organs and takes samples for chemical analysis and microbiological culture. His brain will also have to come out. There's a chance he could have been bleeding in his skull, i.e. a subarachnoid or intracerebral hemorrhage. Hour 9. A saw is used for this procedure, and when it goes through the skull, the smell is similar to the smell at the dentist when a drill is used. Something called a skull key is then used to pry open the bone at the cutting line. The sound is a kind of pop, what you'd expect from the suction. The last part before removal consists of cutting down at the brainstem and severing the optic nerves. Jake's brain is now ready to be weighed and analyzed. 9 hours 20 minutes. She also looks at his great arteries and veins to check for any abnormalities, and to further help her, she'll use X-rays and other imaging methods to get a better look at the intricacies of all his organs. This will include post-mortem magnetic resonance imaging. A microscope is also used. Problems might be evident at the macroscopic level, but sometimes they're only seen at the microscopic level. 10 hours 30 minutes. Now she's finished. She puts the organs back in the correct anatomical place, minus the bits she used for tests. She sews Jake back up again. If this were a criminal case, those organs might be kept for a while longer, with the next of kin's consent at least, but so far Jake's death is not being looked at as a crime. She thinks she now knows why he died, but it's going to be a talking point, that's for sure. In the meantime, Jake can at least be placed back in his fridge awaiting his big day when he gets put in the ground. Hour 48. It's decided Jake will be viewed during his big day, so his parents have asked for the body to be embalmed. They pay the going rate for this, $800, but they have to fork out another $500 on flowers, $200 for a wreath, $3,000 for a headstone, $5,000 for a casket, $1,000 for the funeral plot, and some more cash for the service itself. At just over $10,000 for the whole affair, that's about the average funeral cost in the US. But rich folks' funerals and poor folks' funerals can differ in cost by quite a lot. Cremation can be cheaper, but it sometimes works out the same as Jake's burial. In the USA, families in general are pretty split between choosing cremations or burials. Hour 72. Jake is now in the embalming room and his body has been moved to a stainless steel table. The funeral director holds Jake's arms at the side of his body and closes his eyes and mouth. To ensure they stay closed and don't shock people who later come to see Jake, he glues the eyelids down and also the lips. Jake should look peaceful in the coffin, not like he's just seen a ghost or needs to take a poop. Cotton wool is also stuffed into the facial cavities to prevent anything from leaking out. Hour 73. Some incisions are made in Jake so the embalming fluid can enter him via an artery and a vein, taking out the blood while pumping in a mix of a few chemicals: formaldehyde, glutaraldehyde, methanol, and a few other solvents. This will preserve Jake, although once in the ground, he'll start decomposing in a few days or a week. Again, there are multiple factors as to how fast he'll decompose, including the temperature, the casket, and the soil. Hour 75. As the embalming machine is doing its job, Jake's body is washed from head to toe, including his hair. His fingernails and toenails are clipped, and then when the embalming is done, he gets a blow dry and a styling of his hair. Some makeup is applied to his face, and then the clothes supplied by his family are put on his body. Hour 76. Remember that Jake had a cranial autopsy, and unfortunately, even though the stitches were really well done, the funeral director uses a bit of skin-colored wax to cover the small marks. He now thinks Jake's face looks a bit dried out, so he uses a hypodermic needle to pump a solution in to puff it out. Hour 78. When Jake is put in the coffin, the funeral director fluffs up the pillow to hide any possible skull damage he hasn't been able to fully hide. Goes without saying that shifting a dead body is grueling work, and all that hard work could come undone if Jake's not handled carefully. But fortunately, at this funeral home, they have a machine to lift Jake's 200-pound mass. Hour 79. Finally, his body tag is checked against the tag on the coffin. You really don't want the wrong body in the wrong coffin, and trust us, it's happened. In a very recent case in the US involving a 51-year-old woman, the body was wrong but the clothes were right. Hour 80. They then give Jake one last touch-up and put a block under his pillow so his face is at an angle. A dead person looking down at their feet doesn't look cool, but just looking straight forward looks a bit too corpse-like. When the head is turned slightly to the right, it also ensures that people won't have to bend right over the body to take a look. That might seem like someone's rubbernecking, also not cool at a funeral. Cause of death. We guess you want to know how Jake died. The reason the pathologist wrote down and what was told to Becky and his parents was arrhythmogenic right ventricular cardiomyopathy, ARVC. The problem with this rare kind of death is there are no definitive autopsy criteria to confidently give a diagnosis. What ARVC basically means is the muscles of the heart have been replaced by fatty or fibrous tissue, which is a genetic defect in this case, so Jake was always going to have problems. ARVC often lies silently in wait. Then, when someone exerts themselves in sports or when shouting at Love Island, the heart's electrical signals get all out of whack, and that can lead to a dangerous, life-threatening heart rhythm. It's a controversial diagnosis though, because as we said, even though there might be some fat tissues and fibrosis to see, ARVC is still not that well understood. It's rare, but some of those cases have been stated in the literature have included young people who'd not shown symptoms prior to collapsing. A recent one involved a teenager with no family history of heart problems. He was strong and healthy and then collapsed on the football field at school. His name was also Jake. His story isn't really related to our Jake, but it shows you that if you have a genetic heart problem and it isn't discovered, exertion can send you over the edge, even if it is just screaming at dumb couples after a hard day making chump change in a warehouse so Mr. Bezos can hang out in space. The real-life Jake, by the way, might have survived had he been screened. Our Jake, well, all that hard work, his bad temper, and his occasional cocaine binge didn't bode well for him, and because of the fact that he never got so much as a palpitation, he didn't really have a chance. At least it wasn't Becky that killed him, though. Shame on you for thinking that. She was in a terrible state at the funeral. Love Island will never be the same again. Now you need to watch morgue employees reveal things that would scare everyone. Or have a look at this.